Welcome to another Drug Chug episode. Today we'll talk about osmotic laxatives and how they work, plus some pharmacology. Here's everything in the video, timestamps down below, and a short quiz at the end. To understand osmotic laxatives, first we have to do a quick overview. So what are osmotic laxatives? Well, osmotic means osmosis or movement of water. That's very important to know. There has to be a component of water moving, and we'll talk about that. And laxatives, we know, make you go, right? They make you go to the bathroom. So basically what osmotic laxatives do is they'll have water pull into your colon and large intestine to help you go to the bathroom. We'll talk about this in more detail later, but that is the gist of it. Now, when we talk about laxatives, there's a bunch of different laxatives. We have stimulant laxatives, bulk forming laxatives, stool softeners, also known as emollients, and then the osmotic laxatives. This video will only focus on osmotics and how they work. And in this class, we have a few drugs, some of them super popular. We have polyethylene glycol, also known as PEG 3350 or Miralax for the over-the-counter. There's a product called Lactulose, and then we have magnesium citrate, sodium phosphate. There's a bunch of different types of osmotic laxatives. By far the most popular is the first one, polyethylene glycol. And it's good to know that these drugs are very useful in treating anything from mild constipation to moderate to severe constipation. Also, they're used in full colon prep, so like an endoscopy. But we'll talk about all of this in detail. I just wanted to give you a quick overview. Now we can talk about how osmotic laxatives actually work, their mechanism of action. So remember, osmotic laxatives, they pull in water. A fancy way of saying this is they create an osmotic gradient, and that gradient pulls water into the bowel lumen. So you have more water in your colon and large intestine. So let's look at an example. So if you eat food, right, this burger goes to your stomach, gets digested, goes through your small intestine, then eventually your large intestine, and then through your intestine, eventually to your colon, and then you go to the bathroom, right? Pretty straightforward. Now, if we add Miralax, which is PEG 3350, essentially the PEG acts like a magnet, a hydrophilic magnet, so a magnet that likes to attract water. And what's interesting is this PEG doesn't get absorbed. Basically, it stays in the large intestine eventually until you pass it. So if you have this Miralax acting as a magnet that doesn't get absorbed, it stays in that large intestine. The magnet stays in the colon until you pass it. And while it's there, you guessed it, it's pulling in water. It's hydrophilic, means it likes water. So if you have this PEG in the large intestine, it's going to pull more and more water into the large intestine. And if it does that and you have water in the large intestine, you'll have softer stools. You'll have an increased stool volume. You'll have more rapid movement, also known as peristalsis. So having this water being pulled in basically lets you go to the bathroom more efficiently. Now that we know how osmotic laxatives work, let's talk about when we use them. Well, the first one, we already touched on this. We use them for constipation. It could be occasional constipation, chronic constipation. Usually that PEG 3350 is often the first line product. It works very well, and it's very, very easy to tolerate in a lot of patients. And we can also use these osmotic laxatives for hepatic encephalopathy. That basically means your liver isn't filtering out ammonia and you have an ammonia buildup. And to get rid of it, you can basically take lactulose, which is one of our osmotics, to trap the ammonia so you can excrete out the ammonia. This is a very specific indication for lactulose. It's used very, very religiously with patients that have hepatic encephalopathy. But basically, it makes you go to trap the ammonia and you push out the ammonia. The next thing is bowel prep. So if a patient is having an endoscopy, they're going to be taking this giant 4-liter bucket, gallon, whatever you want to call it, of PEG 3350. And we'll talk about it in more detail. It's a lot of volume, okay? It's a very high dose, and this isn't something you use routinely. It's right before, a day before, you do a bowel prep. And the last thing is if a patient had surgery, we usually put these on board for post-operative constipation, right? We don't want a patient straining, stressing, trying to push out when their body is already recovering. Now that we know when we use these osmotics, let's talk about the dosing and any adjustments. We're going to see 5 different osmotics and we'll talk about the dosing. It's best if you just understand the general concept. But the first one, our most popular one, is polyethylene glycol, also known as Miralax. And here, the pharmaceutical companies had a good name, Miralax, because it's kind of like a miracle because patients tolerate it so well. Now, it is over the counter. They come in powder, so that's 17-gram powder packets or this bottle, and you dissolve it in 4 to 8 ounces of water. Remember, you need water, right? Because it pulls in water. Now, besides the over-the-counter, we also have the prescription bowel prep. This is that big gallon, the 4-liter bucket. It's GoLYTELY as the brand name. And again, the pharmaceutical companies had a clever name, GoLYTELY, meaning you're not going to go that lightly. If you take this 4-liter thing, you are going to be emptied out. And when you do that, there's a lot of PEG 3350 in there, and there's a lot of electrolytes, right, to keep your electrolytes balanced because you're excreting so much. If you take the daily over the counter, it's going to take 1 to 3 days for it to start working. The bowel prep, because it's such a high dose, it will work a lot faster. The good thing about these drugs, there's no renal or hepatic adjustments typically. Some of them there are, but for Miralax specifically, it works amazing. So there is no renal adjustments. There is no hepatic adjustments for people with poor kidney or poor liver functions. Now our next drug is Lactulose. We talked about Lactulose a little bit, but here we can use it for chronic constipation, right? It comes in a liquid, so 15 to 30 milliliters by mouth daily, and you want to titrate it until you get 1 to 2 soft stools a day. Remember, lactulose, you can also use it for hepatic encephalopathy, which is the more common use for it. Here, it's 25 to 30 mLs. You take it by mouth 2 to 4 times a day until you achieve 2 to 3 stools. It's a little bit more aggressive because you want to get that ammonia buildup out of there. And again, look at that. There's no renal adjustment, which is amazing, right? So lactulose is typically for that hepatic encephalopathy treatment. Our next 2 products are magnesium-based products. We have magnesium hydroxide, also known as milk of magnesia. Here, it's a milky white color, so that's where it gets the name, and we use it for constipation, anywhere from 30 to 60 milliliters by mouth once daily. Now, when you talk about magnesium, which is an electrolyte, you want to avoid it in renal impaired patients, right? Because if your kidney can't filter out the magnesium, you get a buildup of magnesium causing hypermagnesemia. And if you have way too much magnesium in your system, it can cause arrhythmias. So avoid this in renally impaired patients. We also have magnesium citrate, similar story. Here, we can use it for bowel prep. You can use it for constipation. It's a clear liquid. Typically, you drink the whole bottle, either half or whole, 150 mLs to 300, and it's a one-time thing. But again, you avoid that in severe renal impaired patients. And the reason is you don't want the buildup of magnesium. Our last osmotic we'll talk about is sodium phosphate. This one's not popular anymore. There's a lot of better options on the market, but we'll talk about it briefly. You can use this for bowel prep or constipation. It comes in an oral form. It comes in a rectal form. You don't want to use this typically because it can actually have a risk to disrupt your electrolyte balance. You want to avoid this in elderly patients. You want to avoid this in renally impaired patients. Yeah, it works, but you don't want too much phosphate in your system. You'll have hyperphosphatemia, and that can cause a bunch of cardiac issues as well. Basically, avoid this product when you can. There's a lot of great options. Your number one option is probably going to be Miralax or that polyethylene glycol, unless you have encephalopathy Then you'll use the lactulose. You have a couple of magnesium products, but overall, this is the majority of the osmotics. Now we could talk about the side effects of these osmotics. The first one is abdominal cramps, and that makes sense. Anytime you use a laxative and you have movement in that large intestine, you have that ability to have cramps, bloating, gas, things like that. If you use too much of these laxatives, it could push you from being constipated to having diarrhea, and that makes sense, right? Because they pull in water. Too much water will cause diarrhea. The next one is specific to our magnesium products, right? You can get hypermagnesemia if you take too much, or if you're renally impaired and can't filter out the magnesium enough. This is specifically to magnesium citrate and magnesium hydroxide, and too much magnesium can cause arrhythmias. And the last one is hyperphosphatemia, and this is only with that sodium phosphate product, and too much phosphate can cause cardiovascular risk. All right, we made it to the end. Let's do a quick summary and a short quiz. We talked about osmotic laxatives. We said that they help you pass your stool easier, and the way they work is they pull water into the colon to help you push that stool. When do we use them? Well, we use them for constipation. We have a specific product for encephalopathy. We can use them for bowel prep, or we can use them in patients that just got out of surgery to help reduce strain. We talked about multiple products. Our most popular was that polyethylene glycol. Brand name was Miralax. That GoLYTEly version was that big 4-liter version, right, before bowel prep. We talked about lactulose, which was used for encephalopathy. We had 2 magnesium products, magnesium hydroxide and citrate, and then a not so popular product, sodium phosphate. Now, these drugs also have some side effects, right? Cramping, bloating. You also have diarrhea if you take too much. If you're renally impaired, you have that hypermagnesium level in your bloodstream and then that hyperphosphate level in your bloodstream, right? So you want to avoid these products in renally impaired patients. So that's everything we talked about. Let's take a short quiz to see what we retained. Question 1. When would we use an osmotic laxative? Question 2. Which of the following best describes the mechanism of action of osmotic laxatives? Question 3. Which of the following is a unique adverse effect associated specifically with sodium phosphate if the patient has poor kidney function? Question 4. Which of these osmotic laxatives are used to treat encephalopathy?